Question 1. A 68-year-old client with a long history of severe chronic obstructive pulmonary disease, COPD, is admitted to the medical unit because of increasing shortness of breath, productive cough, and fatigue. The nurse reviews the client's arterial blood gas, ABG, results, pH 7.36, PaSa2, 58 mm of mercury, HCO3 32 milliequivalent/L, and PaO2 70 mm of mercury. The client is alert, oriented, and speaking in full sentences. A newly hired nurse states that the ABG demonstrates normal acid-base balance because the pH falls within the normal range. Which interpretation by the experienced nurse is most accurate? A. Fully compensated respiratory acidosis. B. Uncompensated respiratory acidosis. C. Fully compensated metabolic alkalosis. D. Mixed respiratory alkalosis and metabolic acidosis. Answer. A. Fully compensated respiratory acidosis. Rationale. The PaSa2 is elevated, indicating respiratory acidosis. The bicarbonate is also elevated, demonstrating renal compensation. The pH is within normal range but leans toward the acidic side, indicating complete compensation. Question 2. A client with diabetic ketoacidosis, DKA, arrives in the emergency department. The client reports excessive thirst, frequent urination, nausea, and abdominal pain. ABG results reveal pH 7.18, PaSa2, 24 mm of mercury, HCO3, 10 milliequivalent/L. Which acid-base imbalance should the nurse identify? A. Uncompensated respiratory acidosis. B. Partially compensated metabolic acidosis. C. Fully compensated metabolic acidosis. D. Partially compensated respiratory alkalosis. Answer. B. Partially compensated metabolic acidosis. Rationale. The pH is acidic. The bicarbonate is significantly decreased, indicating metabolic acidosis. The PaSa2 is decreased because the lungs are attempting to compensate through hyperventilation, but the pH remains abnormal. Question 3. A postoperative client suddenly develops anxiety, tachypnea, dizziness, and numbness around the mouth. The nurse obtains ABGs showing pH 7.52, PaSa2, 28 mm of mercury, HCO3, 24 milliequivalent/L. Which interpretation is correct? A. Uncompensated respiratory alkalosis. B. Partially compensated respiratory alkalosis. C. Metabolic alkalosis. D. Mixed acid-base disorder. Answer. A. Uncompensated respiratory alkalosis. Rationale. The pH is alkalotic and PaSa2 is low, indicating respiratory alkalosis. The bicarbonate remains normal, showing no metabolic compensation has occurred. Question 4. A client with prolonged vomiting has ABG results of pH 7.50, PaSa2 48 mm of mercury, HCO3 34 milliequivalent/L. Which finding best explains these results? A. Respiratory acidosis with compensation. B. Metabolic alkalosis with partial respiratory compensation. C. Respiratory alkalosis. D. Mixed alkalosis. Answer. B. Metabolic alkalosis with partial respiratory compensation. Rationale. Vomiting causes loss of gastric acid, producing metabolic alkalosis. The elevated bicarbonate confirms the primary problem. The increased PaSa2 indicates hypoventilation as compensation. Question 5. A client receiving high-dose opioid therapy becomes difficult to arouse. Respiratory rate is 6 breaths/minute. ABGs reveal pH 7.25, PaSa2 68 mm of mercury, HCO3 26 milliequivalent/L. Which interpretation is most accurate? A. Uncompensated respiratory acidosis. B. Partially compensated respiratory acidosis. C. Metabolic acidosis. D. Respiratory alkalosis. Answer. A. Uncompensated respiratory acidosis. Rationale. Hypoventilation causes carbon dioxide retention. The elevated PaSa2 and acidic pH indicate respiratory acidosis. Bicarbonate remains normal, indicating no compensation. Question 6. A client with septic shock is receiving aggressive treatment in the intensive care unit. ABGs show pH 7.28, PaSa2 30 mm of mercury, HCO3 14 milliequivalent/L. Which interpretation should the nurse make? A. Respiratory acidosis. B. Partially compensated metabolic acidosis. C. Fully compensated metabolic acidosis. D. Metabolic alkalosis. Answer: B. Partially compensated metabolic acidosis. Rationale: the pH is acidic. Bicarbonate is low, indicating metabolic acidosis. PaCO2 is decreased due to compensatory hyperventilation, but pH remains abnormal. Question 7. A client with severe anxiety experiences rapid breathing for several hours. ABGs reveal pH 7.47, PaCO2 32 millimeters of mercury, HCO3 22 milliequivalent/L. Which acid-base imbalance is present? A. Fully compensated respiratory alkalosis. B. Partially compensated respiratory alkalosis. C. Uncompensated respiratory alkalosis. D. Metabolic acidosis. Answer: B. Partially compensated respiratory alkalosis. Rationale: the pH is alkalotic and PaCO2 is low. Bicarbonate has begun decreasing as the kidneys compensate. Since the pH remains abnormal, compensation is only partial. Question 8. A client with advanced renal failure presents with weakness and confusion. ABGs show pH 7.21, PaCO2 33 millimeters of mercury, HCO3 13 milliequivalent/L. Which interpretation is correct? A. Partially compensated metabolic acidosis. B. Respiratory alkalosis. C. Fully compensated respiratory acidosis. D. Metabolic alkalosis. Answer: A. Partially compensated metabolic acidosis. Rationale: kidney failure prevents adequate acid excretion. The low bicarbonate identifies metabolic acidosis. The low PaCO2 reflects respiratory compensation. Question 9. A client with chronic COPD has ABGs of pH 7.32, PaCO2 60 millimeters of mercury, HCO3 31 milliequivalent/L. Which interpretation is most accurate? A. Uncompensated respiratory acidosis. B. Partially compensated respiratory acidosis. C. Fully compensated respiratory acidosis. D. Metabolic alkalosis. Answer: B. Partially compensated respiratory acidosis. Rationale: the pH remains acidic while both PaCO2 and HCO3 are elevated. The kidneys are compensating, but the pH has not returned to normal. Question 10. A client who has been receiving large amounts of antacids reports muscle weakness and confusion. ABGs reveal pH 7.48, PaCO2 46 millimeters of mercury, HCO3 33 milliequivalent/L. Which interpretation is correct? A. Uncompensated metabolic alkalosis. B. Partially compensated metabolic alkalosis. C. Respiratory acidosis. D. Fully compensated metabolic alkalosis. Answer: B. Partially compensated metabolic alkalosis. Rationale: elevated bicarbonate indicates metabolic alkalosis. The elevated PaCO2 shows respiratory compensation through hypoventilation. Because the pH remains alkalotic, compensation is partial. Question 11. A 72-year-old client with severe emphysema is admitted to the intensive care unit for worsening respiratory distress. The client has a respiratory rate of 10 breaths/minute, diminished breath sounds bilaterally, and increasing somnolence. ABG results reveal pH 7.38, PaCO2 62 millimeters of mercury, HCO3 36 milliequivalent/L, and PaO2 68 millimeters of mercury. A novice nurse becomes concerned about the elevated carbon dioxide level and asks whether this client is experiencing acute respiratory failure. Which interpretation should the charge nurse provide? A. Uncompensated respiratory acidosis. B. Fully compensated respiratory acidosis. C. Metabolic alkalosis with compensation. D. Mixed respiratory acidosis and metabolic alkalosis. Answer: B. Fully compensated respiratory acidosis. Rationale: the PaCO2 is elevated, indicating respiratory acidosis. The kidneys have retained bicarbonate to compensate, and the pH has returned to the normal range. This pattern is commonly seen in clients with chronic COPD. Question 12. A client with severe diarrhea for 4 days presents with weakness, hypotension, and tachycardia. Laboratory studies show significant fluid losses. ABGs reveal pH 7.29, PaSO2 31 millimeters of mercury, HCO3 15 milliequivalent/L. Which acid-base imbalance should the nurse identify? A. Partially compensated metabolic acidosis. B. Respiratory alkalosis. C. Uncompensated metabolic acidosis. D. Fully compensated metabolic acidosis. Answer: A. Partially compensated metabolic acidosis. Rationale: diarrhea causes loss of bicarbonate from the gastrointestinal tract. Low HCO3 indicates metabolic acidosis. Decreased PaSO2 demonstrates respiratory compensation through hyperventilation. Question 13. A client with acute pulmonary embolism suddenly develops severe dyspnea and chest pain. The nurse obtains ABGs showing pH 7.51, PaSO2 29 millimeters of mercury, HCO3 24 milliequivalent/L. Which interpretation is most accurate? A. Uncompensated respiratory alkalosis. B. Metabolic alkalosis. C. Partially compensated respiratory alkalosis. D. Mixed disorder. Answer: A. Uncompensated respiratory alkalosis. Rationale: hyperventilation associated with pulmonary embolism lowers PaSO2. Because bicarbonate remains normal, no compensation has occurred. Question 14. A client with persistent nasogastric suctioning develops weakness and muscle cramps. ABGs reveal pH 7.49, PaSO2 49 millimeters of mercury, HCO3 35 milliequivalent/L. Which interpretation is correct? A. Partially compensated metabolic alkalosis. B. Respiratory acidosis. C. Fully compensated metabolic alkalosis. D. Metabolic acidosis. Answer: A. Partially compensated metabolic alkalosis. Rationale: gastric suction removes hydrochloric acid, leading to metabolic alkalosis. Elevated PaSO2 reflects respiratory compensation, but the pH remains alkalotic. Question 15. A client with diabetic ketoacidosis is receiving treatment in the emergency department. 4 hours later, repeat ABGs reveal pH 7.35, PaSO2 28 millimeters of mercury, HCO3 15 milliequivalent/L. Which interpretation should the nurse make? A. Uncompensated metabolic acidosis. B. Fully compensated metabolic acidosis. C. Respiratory alkalosis. D. Mixed metabolic alkalosis and respiratory alkalosis. Answer: B. Fully compensated metabolic acidosis. Rationale: HCO3 remains low, identifying metabolic acidosis. PaSO2 is decreased due to compensation. The pH has normalized, indicating full compensation. Question 16. A client receiving mechanical ventilation becomes increasingly anxious. Ventilator settings are found to be delivering excessive minute ventilation. ABGs reveal pH 7.55, PaSO2 25 millimeters of mercury, HCO3 23 milliequivalent/L. Which acid-base imbalance is present? A. Uncompensated respiratory alkalosis. B. Metabolic alkalosis. C. Partially compensated respiratory alkalosis. D. Respiratory acidosis. Answer: A. Uncompensated respiratory alkalosis. Rationale: excessive ventilation removes carbon dioxide rapidly. The low PaSO2 and elevated pH indicate respiratory alkalosis without metabolic compensation. Question 17. A client with acute kidney injury develops confusion and lethargy. ABGs reveal pH 7.24, PaSO2 34 millimeters of mercury, HCO3 15 milliequivalent/L. Which interpretation is most accurate? A. Respiratory acidosis. B. Partially compensated metabolic acidosis. C. Fully compensated metabolic acidosis. D. Metabolic alkalosis. Answer: B. Partially compensated metabolic acidosis. Rationale: the kidneys cannot adequately remove acids, causing bicarbonate depletion. The lungs compensate by lowering PaSO2, but the pH remains acidic. Question 18. A nurse reviews ABGs from a client experiencing a severe panic attack. Results are pH 7.44, PaSO2 31 millimeters of mercury, HCO3 20 milliequivalent/L. Which interpretation is correct? A. Fully compensated respiratory alkalosis. B. Partially compensated respiratory alkalosis. C. Metabolic acidosis. D. Uncompensated respiratory alkalosis. Answer: A. Fully compensated respiratory alkalosis. Rationale: the PaCO2 is low, indicating respiratory alkalosis. Bicarbonate has decreased due to renal compensation. The pH is within normal limits, but leans toward alkalosis, indicating full compensation. Question 19. A client with septic shock develops lactic acidosis. ABGs reveal pH 7.17, PaCO2 20 millimeters of mercury, HCO3 8 milliequivalent/L. Which finding requires the nurse to recognize severe acid-base imbalance? A. Uncompensated respiratory acidosis. B. Fully compensated metabolic acidosis. C. Partially compensated metabolic acidosis. D. Respiratory alkalosis. Answer: C. Partially compensated metabolic acidosis. Rationale: lactic acid accumulation lowers bicarbonate and pH. The respiratory system attempts compensation by reducing PaCO2 through rapid breathing, but the pH remains severely acidic. Question 20. A client with COPD develops excessive vomiting from gastroenteritis. ABGs reveal pH 7.40, PaCO2 55 millimeters of mercury, HCO3 34 milliequivalent/L. The nurse notices that both PaCO2 and HCO3 are elevated while the pH is perfectly normal. Which interpretation is most appropriate? A. Fully compensated respiratory acidosis. B. Fully compensated metabolic alkalosis. C. Mixed respiratory acidosis and metabolic alkalosis. D. Uncompensated respiratory acidosis. Answer: C. Mixed respiratory acidosis and metabolic alkalosis. Rationale: this is a classic Nclex acid-base trick question. The elevated PaCO2 suggests respiratory acidosis from COPD, while the elevated HCO3 suggests metabolic alkalosis from vomiting. Because two separate disorders are occurring simultaneously, this represents a mixed acid-base disorder rather than simple compensation. Question 21. A client with severe diabetic ketoacidosis, DKA, is admitted to the intensive care unit. Initial ABGs reveal pH 7.12, PaCO2 22 millimeters of mercury, and HCO3 8 milliequivalent/L. 4 hours later, after insulin therapy and aggressive fluid replacement, repeat ABGs show pH 7.28, PaCO2 25 millimeters of mercury, and HCO3 12 milliequivalent/L. Which conclusion should the nurse make regarding the client's acid-base status? A. The client is developing respiratory acidosis. B. The metabolic acidosis is improving but remains partially compensated. C. The client has fully compensated metabolic acidosis. D. The client is developing metabolic alkalosis. Answer: B. The metabolic acidosis is improving but remains partially compensated. Rationale: the pH and bicarbonate are improving but remain abnormal. The low PaCO2 reflects continued respiratory compensation. Because the pH is still acidic, full compensation has not occurred. Question 22. A mechanically ventilated client develops sudden agitation and tachycardia. The nurse reviews the most recent ABGs. pH 7.56, PaCO2 24 millimeters of mercury, HCO3 22 milliequivalent/L. Which nursing action is the priority? A. Increase ventilator rate further. B. Assess for excessive mechanical ventilation and notify the provider. C. Administer sodium bicarbonate. D. Restrict oxygen administration. Answer: B. Assess for excessive mechanical ventilation and notify the provider. Rationale: the client is experiencing respiratory alkalosis caused by excessive carbon dioxide elimination. Ventilator settings may require adjustment to prevent worsening alkalosis. Question 23. A client with chronic kidney disease develops worsening confusion and weakness. ABGs reveal pH 7.20, PaCO2 29 millimeters of mercury, HCO3 11 milliequivalent/L. Which assessment finding would the nurse most likely expect? A. bradypnea and hypoventilation. B. Kussmaul respirations. C. Shallow respirations with apnea. D. Respiratory depression from compensation. Answer: B. Kussmaul respirations. Rationale: severe metabolic acidosis stimulates deep, rapid respirations to eliminate carbon dioxide and compensate for excess acid. Question 24. A client admitted for a panic disorder experiences acute hyperventilation. ABGs reveal: pH 7.54, PaCO2 26 millimeters of mercury, HCO3 24 milliequivalent/L. Which intervention should the nurse implement first? A. Administer sodium bicarbonate. B. Encourage slow, controlled breathing techniques. C. Restrict oral fluids. D. Place the client in Trendelenburg position. Answer: B. Encourage slow, controlled breathing techniques. Rationale: hyperventilation causes excessive CO2 loss leading to respiratory alkalosis. Slowing respirations addresses the underlying cause. Question 25. A client with COPD who normally has compensated respiratory acidosis suddenly becomes lethargic after receiving intravenous opioids. Current ABGs reveal: pH 7.24, PaCO2 76 millimeters of mercury, HCO3 34 milliequivalent/L. Which interpretation is most accurate? A. Acute on chronic respiratory acidosis. B. Fully compensated respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer: A. Acute on chronic respiratory acidosis. Rationale: the client previously compensated for chronic CO2 retention. Opioid-induced hypoventilation caused additional CO2 accumulation, resulting in an acidic pH and worsening respiratory acidosis. Question 26. A client with severe sepsis has the following ABGs: pH 7.08, PaCO2 18 millimeters of mercury, HCO3 6 milliequivalent/L. Which finding is most concerning? A. Mild compensated acidosis. B. Severe metabolic acidosis with respiratory compensation. C. Respiratory alkalosis only. D. Metabolic alkalosis. Answer: B. Severe metabolic acidosis with respiratory compensation. Rationale: the extremely low pH and bicarbonate indicate life-threatening metabolic acidosis. Hyperventilation lowers PaCO2 as a compensatory response. Question 27. A nurse is evaluating a client's ABGs. pH 7.40, PaCO2 50 millimeters of mercury, HCO3 31 milliequivalent/L. Which interpretation is correct? A. Fully compensated respiratory acidosis. B. Uncompensated respiratory acidosis. C. Metabolic alkalosis. D. Mixed acidosis. Answer: A. Fully compensated respiratory acidosis. Rationale: the elevated PaCO2 indicates respiratory acidosis. Elevated bicarbonate demonstrates renal compensation. The normal pH confirms complete compensation. Question 28. A client with severe vomiting and COPD has the following ABGs: pH 7.46, PaCO2 58 millimeters of mercury, HCO3 39 milliequivalent/L. Which interpretation is most accurate? A. Fully compensated respiratory acidosis. B. Mixed respiratory acidosis and metabolic alkalosis. C. Respiratory alkalosis. D. Uncompensated metabolic alkalosis. Answer: B. Mixed respiratory acidosis and metabolic alkalosis. Rationale: COPD contributes to respiratory acidosis, while vomiting contributes to metabolic alkalosis. The coexistence of two separate disease processes indicates a mixed disorder. Question 29. A nurse receives ABG results on a postoperative client. pH 7.30, PaCO2 50 millimeters of mercury, HCO3 24 milliequivalent/L. Which assessment finding would most likely accompany these results? A. Hyperventilation and anxiety. B. Respiratory depression from narcotics. C. Profuse diarrhea. D. Kussmaul respirations. Answer: B. Respiratory depression from narcotics. Rationale: elevated PaCO2 with acidic pH indicates respiratory acidosis. Postoperative opioid administration commonly causes hypoventilation and carbon dioxide retention. Question 30. A client in the ICU has the following ABG trend. Which interpretation best describes the trend? A. Worsening respiratory acidosis. B. Development of metabolic alkalosis. C. Gradual correction of respiratory acidosis toward normal acid-base balance. D. Development of mixed acid-base disorder. Answer. C. Gradual correction of respiratory acidosis toward normal acid-base balance. Rationale. The pH is steadily increasing toward normal while PaCO2 decreases. This trend demonstrates improving ventilation and resolution of respiratory acidosis. Question 31. A 74-year-old client with severe COPD is admitted to the ICU with pneumonia. The nurse reviews the following ABG results. pH 7.29. PaCO2 68 mm of mercury. HCO3 33 milliequivalent/L. PaO2 58 mm of mercury. The client normally has compensated respiratory acidosis at baseline. Compared with previous records, the PaCO2 has increased significantly over the past 24 hours. Which interpretation is most accurate? A. Fully compensated respiratory acidosis. B. Acute on chronic respiratory acidosis. C. Metabolic alkalosis with compensation. D. Mixed respiratory alkalosis and metabolic acidosis. Answer. B. Acute on chronic respiratory acidosis. Rationale. Chronic COPD causes long-term CO2 retention with renal compensation. The worsening pH and rising PaCO2 indicate an acute deterioration superimposed on a chronic condition. Question 32. A mechanically ventilated client has the following ABGs. pH 7.57. PaCO2 23 mm of mercury. HCO3 21 milliequivalent/L. The ventilator is set at a respiratory rate of 24 breaths/minute. Which provider prescription should the nurse anticipate? A. Increase respiratory rate. B. Increase tidal volume. C. Decrease minute ventilation. D. Administer sodium bicarbonate. Answer. C. Decrease minute ventilation. Rationale. Excessive ventilation is causing respiratory alkalosis. Reducing minute ventilation allows PaCO2 to rise toward normal. Question 33. A client with septic shock develops severe lactic acidosis. ABGs reveal. pH 7.11. PaCO2 19 mm of mercury. HCO3 7 milliequivalent/L. Which clinical manifestation would the nurse expect? A. Slow shallow respirations. B. Bradycardia and sedation only. C. Deep rapid respirations with increasing fatigue. D. Respiratory depression. Answer. C. Deep rapid respirations with increasing fatigue. Rationale. Severe metabolic acidosis stimulates aggressive respiratory compensation, Kussmaul respirations, to eliminate carbon dioxide. Question 34. A client presents with prolonged vomiting and excessive use of calcium carbonate antacids. ABGs reveal. pH 7.55. PaCO2 50 mm of mercury. HCO3 40 milliequivalent/L. Which interpretation is correct? A. Partially compensated metabolic alkalosis. B. Fully compensated metabolic alkalosis. C. Respiratory acidosis. D. Mixed acidosis. Answer. A. Partially compensated metabolic alkalosis. Rationale. Elevated bicarbonate identifies metabolic alkalosis. Increased PaCO2 demonstrates respiratory compensation. The pH remains alkalotic, so compensation is incomplete. Question 35. A nurse is caring for a client with diabetic ketoacidosis. The client suddenly becomes lethargic and develops shallow respirations. Repeat ABGs reveal. pH 7.10. PaCO2 50 mm of mercury. HCO3 15 milliequivalent/L. Which interpretation is most accurate? A. Metabolic acidosis only. B. Respiratory alkalosis only. C. Mixed metabolic and respiratory acidosis. D. Fully compensated metabolic acidosis. Answer. C. Mixed metabolic and respiratory acidosis. Rationale. DKA causes metabolic acidosis, low HCO3. The elevated PaCO2 indicates inadequate ventilation rather than compensation. Two acidotic processes are occurring simultaneously. Question 36. A client with chronic kidney disease develops worsening renal failure. ABGs reveal pH 7.26, PaCO2 30 mm of mercury, HCO3 13 milliequivalent/L. Which nursing assessment finding is most consistent with these results? A. Hyperventilation. B. Respiratory depression. C. Excessive sedation. D. Hypoventilation. Answer: A. Hyperventilation. Rationale: metabolic acidosis stimulates the respiratory center, resulting in increased respiratory rate and depth to compensate for excess acid. Question 37. The nurse reviews ABGs from a client who experienced a severe panic attack 6 hours ago. pH 7.41, PaCO2 30 mm of mercury, HCO3 19 milliequivalent/L. Which interpretation is most accurate? A. Fully compensated respiratory alkalosis. B. Metabolic acidosis. C. Uncompensated respiratory alkalosis. D. Respiratory acidosis. Answer: A. Fully compensated respiratory alkalosis. Rationale: low PaCO2 indicates respiratory alkalosis. The kidneys have reduced bicarbonate to compensate. The normal pH indicates complete compensation. Question 38. A client with COPD and chronic CO2 retention is admitted for severe dehydration caused by prolonged vomiting. ABGs reveal pH 7.48, PaCO2 60 mm of mercury, HCO3 43 milliequivalent/L. Which interpretation should the nurse make? A. Fully compensated respiratory acidosis. B. Mixed respiratory acidosis and metabolic alkalosis. C. Respiratory alkalosis. D. Uncompensated metabolic alkalosis. Answer: B. Mixed respiratory acidosis and metabolic alkalosis. Rationale: COPD contributes respiratory acidosis, while vomiting causes metabolic alkalosis. The coexistence of two independent disease processes indicates a mixed disorder. Question 39. A client with acute respiratory distress syndrome, ARDS, is receiving mechanical ventilation. ABGs reveal pH 7.31, PaCO2 55 mm of mercury, HCO3 27 milliequivalent/L. Which acid-base imbalance is present? A. Uncompensated respiratory acidosis. B. Partially compensated respiratory acidosis. C. Fully compensated respiratory acidosis. D. Metabolic alkalosis. Answer: B. Partially compensated respiratory acidosis. Rationale: elevated PaCO2 causes respiratory acidosis. The slightly elevated bicarbonate indicates compensation has begun, but the pH remains acidic. Question 40. A nurse is analyzing a client's ABG trend over the past 12 hours. Which conclusion is most accurate? A. Respiratory acidosis is worsening. B. Metabolic alkalosis is developing. C. Respiratory alkalosis is resolving toward normal acid-base balance. D. Mixed respiratory and metabolic acidosis is occurring. Answer: C. Respiratory alkalosis is resolving toward normal acid-base balance. Rationale: the pH is gradually returning to normal while PaCO2 increases toward normal. This trend suggests improvement of respiratory alkalosis. Question 41. A client with septic shock is being treated in the ICU. 6 hours ago, the ABGs were pH 7.26, PaCO2 28 mm of mercury, HCO3 12 milliequivalent/L. The most recent ABGs are pH 7.09, PaCO2 52 mm of mercury, HCO3 12 milliequivalent/L. Which interpretation is most accurate? A. Improving metabolic acidosis. B. Fully compensated metabolic acidosis. C. Mixed metabolic acidosis and respiratory acidosis. D. Respiratory alkalosis. Answer: C. Mixed metabolic acidosis and respiratory acidosis. Rationale: the bicarbonate remains critically low, indicating persistent metabolic acidosis. The PaCO2 has increased instead of remaining low, indicating respiratory failure and superimposed respiratory acidosis. Question 42. A client with COPD is admitted for an acute exacerbation. The nurse reviews the ABGs. pH 7.37. PaCO2, 59 millimeters of mercury. HCO3, 34 milliequivalent/L. Which conclusion should the nurse make? A. Uncompensated respiratory acidosis. B. Fully compensated respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer. B. Fully compensated respiratory acidosis. Rationale. Elevated PaCO2 indicates respiratory acidosis. Elevated bicarbonate reflects renal compensation. The normal pH demonstrates full compensation. Question 43. A client develops severe anxiety while awaiting emergency surgery. ABGs reveal. pH 7.53. PaCO2, 27 millimeters of mercury. HCO3, 23 milliequivalent/L. Which intervention should the nurse implement first? A. Administer sodium bicarbonate. B. Encourage slow, controlled breathing and reduce anxiety stimuli. C. Restrict fluids. D. Prepare for intubation. Answer. B. Encourage slow, controlled breathing and reduce anxiety stimuli. Rationale. Hyperventilation from anxiety causes respiratory alkalosis. Addressing the underlying cause is the priority intervention. Question 44. A client with end-stage renal disease misses several dialysis treatments. ABGs reveal. pH 7.18. PaCO2, 29 millimeters of mercury. HCO3, 10 milliequivalent/L. Which assessment finding would the nurse most likely observe? A. Kussmaul respirations. B. Bradypnea. C. Respiratory depression. D. Hypoventilation. Answer. A. Kussmaul respirations. Rationale. Severe metabolic acidosis stimulates deep, rapid respirations as the body attempts to remove carbon dioxide and compensate. Question 45. A client receiving mechanical ventilation develops the following ABGs. pH 7.60. PaCO2, 20 millimeters of mercury. HCO3, 22 milliequivalent/L. Which provider order should the nurse anticipate? A. Increase ventilator respiratory rate. B. Increase tidal volume. C. Reduce minute ventilation settings. D. Administer bicarbonate. Answer. C. Reduce minute ventilation settings. Rationale. Excessive ventilation is causing respiratory alkalosis. Lowering minute ventilation will allow PaCO2 to increase toward normal. Question 46. A client has experienced persistent vomiting for several days. ABGs reveal. pH 7.51. PaCO2, 47 millimeters of mercury. HCO3, 35 milliequivalent/L. Which interpretation is correct? A. Partially compensated metabolic alkalosis. B. Respiratory acidosis. C. Fully compensated metabolic alkalosis. D. Metabolic acidosis. Answer. A. Partially compensated metabolic alkalosis. Rationale. Elevated bicarbonate identifies metabolic alkalosis. Increased PaCO2 indicates respiratory compensation. The pH remains alkalotic, showing partial compensation. Question 47. A client with diabetic ketoacidosis suddenly develops fatigue and shallow respirations. ABGs reveal. pH 7.05. PaCO2, 55 millimeters of mercury. HCO3, 14 milliequivalent/L. Which nursing action is the priority? A. Document expected compensation. B. Continue routine monitoring only. C. Notify the provider immediately because respiratory failure is developing. D. Encourage ambulation. Answer. C. Notify the provider immediately because respiratory failure is developing. Rationale. DKA should trigger respiratory compensation with low PaCO2. The elevated PaCO2 indicates respiratory failure and a dangerous mixed acidosis requiring urgent intervention. Question 48. A nurse reviews ABGs from a client with chronic COPD. pH 7.40. PaCO2, 54 millimeters of mercury. HCO3, 33 milliequivalent/L. Which statement best describes these results? A. Acute respiratory failure. B. Fully compensated respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer. B. Fully compensated respiratory acidosis. Rationale: chronic carbon dioxide retention has been compensated by renal bicarbonate retention, resulting in a normal pH. Question 49. A client has the following ABGs: pH 7.32, PaCO2 32 mm of mercury, HCO3 16 milliequivalent/L. Which acid-base imbalance is present? A. Partially compensated metabolic acidosis. B. Uncompensated metabolic acidosis. C. Respiratory acidosis. D. Respiratory alkalosis. Answer: A. Partially compensated metabolic acidosis. Rationale: the low bicarbonate identifies metabolic acidosis. The low PaCO2 demonstrates respiratory compensation. The pH remains acidic, indicating partial compensation. Question 50. A critically ill client has the following ABG trend. Which conclusion should the nurse make? A. Respiratory acidosis is worsening. B. Metabolic acidosis is developing. C. Ventilation is improving and respiratory acidosis is resolving. D. Mixed acid-base disorder is worsening. Answer: C. Ventilation is improving and respiratory acidosis is resolving. Rationale: the pH is steadily increasing toward normal while PaCO2 is decreasing toward normal values. These trends indicate improved ventilation and resolution of respiratory acidosis. Congratulations on completing 50 Nclex, the most confusing ABG questions, the most failed acid-base tricks. ABG interpretation is not about memorizing numbers. It is about recognizing patterns, identifying the primary disorder, spotting compensation, and detecting dangerous mixed acid-base imbalances before they become life-threatening. Mastering these concepts will strengthen your performance in critical care, emergency nursing, medical surgical nursing, and NGN case studies. Keep practicing trend analysis, compensation rules, and mixed disorder recognition. The more ABGs you interpret, the faster you will identify the hidden Nclex traps that challenge many test takers. Study smart, think critically, and keep moving closer to that RN license. You've got this.